Hello and thank you for downloading. My name's Steve Johnson, and this is the Inquests and Inquiries podcast. Hi and welcome to this episode. Sorry for the longer delay. I've been doing a lot of work on the Inquests and Inquiries website, so it's been a while since the last podcast. The podcast we've got for you today is of the Vale of Leven Hospital inquiry, which was commissioned to investigate a significant outbreak of Clostridium difficile between 2007 and 2008. It's really interesting. The report itself details systemic failures in infection control, patient care and governance, areas which, if we sort of spin forward 10 years, are really critical to the COVID inquiry as well. And indeed, areas such as infection control are incredibly contentious issues within the NHS at times, particularly with aspects of perception of some infection control measures which are perhaps seen as onerous or unnecessary. And it really highlights the challenge of maintaining high levels of governance and control constantly when people may not always perceive the threat or the risk. This particular large language model podcast is going to actually combine the report itself and also the Scottish Government's formal response to the inquiry report. And so without further ado, I hand you over to our AI podcasters who will discuss these two reports.
Okay, so we're diving into a pretty heavy story today. The Vale of Leven Hospital in Scotland, between 2007 and 2008. A C. difficile outbreak there, and tragically, it resulted in 34 deaths.
Yeah, it really makes you wonder, how could something like that happen?
Right. What went wrong? And more importantly, what can we learn from this to prevent it from happening again?
I think what's really striking about this case is that it wasn't just, a one-time thing. This outbreak went on for quite a while, affecting a significant portion of the hospital's patients.
And yeah, to really understand how all this unfolded, we're looking at two key sources. First, the official inquiry report. It was led by Lord Maclean, and it really digs deep into the causes of the outbreak. And it also offers 75 recommendations to prevent future tragedies.
That's a lot of recommendations.
It is. It's like a roadmap to a safer healthcare system.
Yeah, and alongside that, we also have the Scottish Government's response to the inquiry, outlining the actions they've taken and what they plan to take to address those issues. It's like a story of accountability, trying to learn from a very painful experience.
So let's set the scene a little bit. The Vale of Leven Hospital, VOLH for short, it's a relatively small community hospital. About 136 beds.
Okay, yeah.
Now get this, 143 patients were affected by this outbreak.
Wow, that's even more than the bed capacity of the entire hospital.
Exactly. More than the entire bed capacity. We're talking about healthcare-associated infections, or HAIs, huge public health issue. And C. difficile, specifically, it's a bacterium that can cause some pretty serious infections in the colon.
Yeah, it can be really nasty.
And one thing that really got to me reading through the report was this one story. A relative, they only found out that their loved one even had C. difficile when they saw it on the death certificate. Imagine that.
Oh, that's just awful. It really highlights the human cost of these failures. And the report paints a picture of a hospital that was really struggling at the time. Reduced services, low morale among the staff, even a rundown physical environment. It all points to vulnerability, both for the hospital and, of course, for the patients.
Yeah, it's like you have this small hospital facing all these challenges, and then, boom, C. difficile hits hard. And what Lord Maclean's inquiry found was that it wasn't just individual mistakes, it was systemic failures, deeply rooted in the system.
Yes, systemic issues are always the hardest to address.
They really are. And the inquiry points to failures in governance and leadership as major contributors.
So essentially, not enough checks and balances in place to ensure quality of care.
Exactly. Clinical governance, that's what it's called. It's that system of checks and balances. And at VOLH, that system was essentially broken.
So, no one was really steering the ship, making sure everything was running smoothly.
That's exactly it. A real lack of focus on infection prevention and control at every level. From the wards themselves all the way up to the Clyde Directorate, which was in charge of overseeing VOLH.
It sounds like a complete breakdown in accountability.
And Lord Maclean, he didn't hold back. He said the leadership at the Clyde Directorate wasn't proactive enough, allowing problems to fester. like that dysfunctional infection control system.
Ouch.
And even at the national level, the Scottish government admitted that their oversight was inadequate. It's like this cascade of failures, from the ground level all the way to the top.
Like a row of dominoes, just
Yeah.
waiting for one to tip over and set off the whole chain reaction. It's pretty heavy stuff.
It really is, and the report doesn't shy away from that. It specifically calls out failures in nursing and medical care, and that's where things get even more concerning.
Yeah, that's where the rubber really meets the road, right? Where the policies and procedures translate into real action.
Exactly. And the findings from the independent nursing experts, they were pretty shocking. They found cases where basic hygiene was just overlooked, like dirty fingernails, full catheter bags left unattended, a general lack of attention to things that, should be second nature in nursing.
Yeah, that's alarming.
And what was even more alarming was the attitude toward record keeping. Nurses were downplaying its importance, almost as if they didn't grasp how crucial it is, especially in a situation like this. It's like they were missing the gravity of the whole situation.
It's almost like they were thinking, well, we're a small team. We know our patients. But healthcare doesn't work that way. Those records are crucial for tracking trends, for accountability, for patient safety.
You need those records. And the failures weren't limited to nursing care either. The report also highlights failures in medical care, inadequate reviews of patients, poor supervision of junior doctors, inappropriate prescribing of antibiotics. I mean, the list goes on.
It sounds like there were problems at every level.
And there's this detail about the antibiotic guidelines that's almost unbelievable. Different doctors are using different guidelines.
Wow. How can you possibly have a unified approach to patient care with that kind of inconsistency?
Right. It's a recipe for disaster. And Lord McLean, he was very blunt in his conclusion about the medical care provided at VLH. He called it inadequate, and he saw a direct link between these failures and the suffering of patients.
So that brings us to the heart of the issue, really. Infection prevention and control.
Or maybe we should say the lack thereof.
Right, because the expert analysis in the report showed just a total breakdown of this crucial system at VOLH. It's almost hard to believe how many opportunities to intervene were missed.
Like repeatedly, investigations into rising C. difficile cases just weren't conducted, even when there were clear warning signs. It's like ignoring a fire alarm because you think it's a false alarm.
And then, the inquiry actually found it inconceivable that there weren't any outbreaks before this major one, meaning there were probably smaller outbreaks that were simply not recognized or acted upon.
Yeah, like little fires that were smoldering and just waiting to erupt.
And then the failures of key personnel. That's especially troubling. The report mentions Dr. Biggs, the infection control doctor. She basically abandoned her responsibilities at VOLH, a serious and professionally unacceptable failure. And yet, it went completely unaddressed by her superiors.
You're left wondering, how could this happen? And then, on top of everything else, there were the surveillance gaps. VOLH wasn't using statistical process control charts, which are, essential tools for tracking infections. Imagine trying to navigate a ship without a compass or a map.
You'd be lost at sea, completely blind to the potential dangers.
Exactly. And without those charts, they were flying blind, unable to see the trends that would have alerted them to the growing problem. A cascade of errors, each one compounding the last. So you've got this perfect storm brewing: governance failures, leadership failures, nursing, medical care, infection control, all converging on this one small hospital. What happens next?
Well, it's easy to get overwhelmed by all of this. But the most critical part is figuring out how to prevent this from ever happening again. And thankfully, both the inquiry and the Scottish government have laid out some concrete steps towards change. It's easy to just get bogged down by the sheer number of failures that happen here. But what's really important is, understanding what's being done to prevent something like this from happening again.
Right.
And both the inquiry and the Scottish government, they've actually laid out some concrete steps toward change.
So that brings us to those 75 recommendations from Lord McLean. It's not just a checklist, though, is it? It's more like a blueprint for systemic change, a way to prioritize patient safety across Scotland.
Yeah, exactly. They're designed to make a real difference. And some of them, they directly address the failures that we've been talking about. For example, recommendation 1. That empowers the Healthcare Environment Inspectorate, so that's the HEI. It gives them the power to actually close wards, if they pose an immediate risk to patients. Do you imagine if that power had existed back in 2007?
It could have been a game changer. But even without that power back then, the HEI, since it was established in 2009, it's made a significant impact. They can conduct both announced and unannounced inspections. So hospitals really have to stay on their toes. It's like having a health inspector for restaurants, but for hospitals.
Yeah, accountability is key. And the HEI, they actually publish their inspection results online for everyone to see. That transparency can really drive improvement. And interestingly enough, the report mentions that VLH actually received positive reviews from the HEI in 2011 and 2012.
So in a way, that's a testament to the changes they've made, right? VOLH, once a symbol of these systemic failures, is now actually meeting the standards. Of course, that doesn't erase the tragedy, but it does offer a glimmer of hope, doesn't it?
It does. It really shows that change is possible. But it's not just about inspections. The inquiry also called for stronger national policies and guidance on infection prevention and control. Remember, recommendation 2. Having clear implementation strategies and ongoing monitoring, that's crucial.
Because what good is a policy if it's just, gathering dust on a shelf? And the Scottish government has stepped up its game in this area. They've issued updated guidelines, they've enhanced training programs, and they're providing more resources to hospitals.
And it's not just about telling hospitals what to do, it's about working together, right? And the establishment of those local HEI task forces, as recommended by the report. That's a great example of that.
Can you explain a little bit about what those are and what they do?
Sure. So these task forces, they bring together experts and stakeholders at the local level. And their job is to really make sure that those national policies are actually being implemented effectively on the ground. It's about taking that top-down guidance and translating it into real action.
So it's about bridging that gap between policy and practice, making sure the guidelines aren't just, words on paper. That makes a lot of sense. Another thing that really stood out to me in the report was the emphasis on data. Remember how VLH wasn't using those statistical process control charts?
Right. The report really highlighted how important it is to have robust surveillance systems in place. It's like having a smoke detector in your house. You need to know if there's a problem before it becomes a full-blown fire.
Exactly. And thankfully, there have been improvements in this area, too. The Scottish government, they now collect national surveillance data on C. difficile and other HAIs. This allows them to track trends, to identify any areas of concern, and also to measure how effective their interventions are.
So it's about moving from a reactive approach to a proactive one. And that shift really requires data. You need to know what's happening in real time so you can intervene before small problems turn into those big tragedies.
It almost feels like a detective story, We're piecing together the clues, trying to understand how this outbreak happened, and then looking for ways to prevent it from happening again. Pretty intense.
It is. And speaking of changing how things are done, the report also emphasized the need for kind of a cultural shift within hospitals, moving away from seeing infection prevention and control as just a box to tick, and moving toward a deep understanding of its importance.
So it's not just about following the rules, but about understanding why those rules exist and taking ownership of patient safety. Everyone, from the cleaning staff to the surgeons, being on the same page.
Exactly. And that's where leadership comes in. Creating an environment where everyone feels empowered to speak up if they see something wrong, and where they understand their role in keeping patients safe from infection.
It's a tall order, though, isn't it? Changing an entire culture. But the Scottish government seems to be taking it seriously. They've implemented these programs, like the Cleanliness Champions program and the Standard Infection Control Precautions campaign.
Yeah. Those programs are really about more than just following the rules. It's about empowering the staff to take ownership of infection prevention, making it a core value within the system.
And it's about transparency, too. Remember how some relatives in the VOLH case, they only found out about their loved one's C. difficile infections from the death certificates? That lack of communication, it was devastating.
Absolutely. The report really recommends open communication with patients and their families. If someone has C. difficile, they deserve to know. And healthcare providers, they need to be honest about the risks, especially for older patients, who are more vulnerable to this infection.
It's about respecting the patient's right to make informed decisions about their care. And it's about providing closure to families, too. They deserve to know what happened. That transparency is so crucial, not only for patient safety, but also for the healing process, for families who have been impacted by these tragedies.
So we've covered a lot of ground. We've seen how all these systemic failures led to a devastating outbreak, but we've also seen how the inquiry's recommendations and the Scottish government's response have led to some pretty significant changes.
It's been quite a journey, hasn't it? A story of tragedy, accountability, and ultimately a drive towards progress. But there's one more piece of the puzzle that we need to explore before we wrap things up. We've talked a lot about the big picture stuff, the systemic changes, the national policies, the hospital inspections. But at the end of the day, this story, it's really about people. The patients, the families, and the healthcare workers who were right there on the front lines.
Yeah, it's really easy to get lost in the policy documents, the statistics, but it's important to remember that each data point, it represents a human life, a story of illness, of suffering, and sadly, in too many cases, loss.
And that's where the report's focus on professional practice really hits home for me. It's not enough to have good policies if the people actually implementing them aren't properly trained, if they're not supported, not empowered to do their jobs well.
Yeah, think back to, those nursing failures we talked about earlier, the lapses in basic hygiene, the inadequate care planning, that dismissive attitude toward record keeping. Those weren't just isolated incidents. They were symptoms of a much deeper problem.
The report highlighted a lack of clear professional responsibility, a breakdown in communication between different levels of staff, and honestly, just a lack of respect for how serious this situation was.
And that's where Recommendation 13 comes in.
Right.
Establishing a clear line of professional responsibility from the ward all the way to the board. Everyone needs to understand their role, their accountability, and the potential consequences of their actions. It's about creating that culture of ownership where nurses, they feel empowered to speak up if they see something's wrong, and where they really understand how crucial their role is in infection prevention and control.
But it's not just about holding people accountable, is it? It's also about giving them the support they need. Nurses need access to proper training, to clear guidelines, and they need adequate staffing levels to do their jobs well. I mean, if they're overwhelmed, if they're overworked, if they feel undervalued, mistakes are going to happen.
Of course. And the inquiry also uncovered some pretty big issues with the medical care at VOLH. Remember the chaotic state of the antibiotic guidelines, the lack of proper medical reviews, the poor supervision of junior doctors. I mean, those are all serious red flags.
Yeah, the report really stressed how important it is to have those clear, consistent protocols, proper supervision, and a commitment to ongoing education for all medical staff. It's about making sure that everyone is practicing at the highest level, using the most up-to-date information, and always putting patient safety first.
And that brings us to another really crucial point, antibiotic stewardship. The overuse and misuse of antibiotics is a major driver of C. difficile infections. It's a global problem. But the VLLH outbreak showed just how quickly things can spiral out of control.
So it's not just about treating the infection once it happens, it's about preventing it in the first place. What steps have been taken to address that?
Well, the report, it called for stricter guidelines on antibiotic prescribing, better monitoring of antibiotic use, and increased education for both healthcare workers and the public about the risks of overusing antibiotics.
Sounds like they're really trying to tackle this from all sides.
They are. The Scottish government, they've actually implemented a number of initiatives, like the Scottish Management of Antimicrobial Resistance Action Plan. And they've also strengthened the role of antimicrobial management teams within hospitals. It's this multi-pronged approach, really, focusing on education, surveillance, and changes to policy. The goal is to make sure that antibiotics are used appropriately, effectively, and only when they're absolutely necessary.
It's a battle being fought on many fronts, and it's one we can't afford to lose. The stakes are too high.
They really are. And beyond just the antibiotics, the inquiry highlighted some other really key aspects of professional practice: accurate and timely record keeping, effective communication with patients and their families, and a commitment to ongoing learning and improvement.
It might seem like those are just basic principles, but the VOL outbreak showed just how easily they can be overlooked, and with devastating consequences. It's a stark reminder that excellence in healthcare requires constant vigilance, a commitment to best practices, and a deep respect for the vulnerability of patients.
Yeah, I think that's a really important takeaway. We've uncovered the failures of VLH, we've explored the lessons learned, and we've looked at the changes that have been implemented. But I think it's important to leave you with one final thought.
Sure.
Given everything we've talked about, how confident are you in the current state of our healthcare system?
It's a great question. What steps can we take, as individuals, as patients, as members of society, to make sure that a tragedy like this never happens again? It's a conversation worth having, a responsibility we all share. Because at the end of the day, patient safety is everyone's business.
Thank you for listening to the Inquests and Inquiries podcast. Remember, you can find more information on the website, inquestsandinquiries.com, or on the YouTube channel as well. Link in the notes.